Tegemean logo getting a octilindo, Gogo meet a conyoy cannot in clinical officers to meet in Kotu yet up Kenebakuko, Chota Chabaisian Civitali Tower, Nabamoitish Gender Farrell, El Rate, in County Neba was in Gisho, Kalamawek Tiger by Sunigo Gigas Sergali, Gangunyo Shakwaga, Kaimoj Kaibonuga, Oret Kondo, Chin Sirin de Nebakuko, Norton Go George Kibore, Olega Mai Chegole, going in Elgibaisiet Casatanabe to Sectaman, Comatena Goyenigone, Comamitan Gako, Tigalactul Chicago Sergali Tab, Eman. Ministry Nebot Lilindom. Kangunya Shakwago Chabota get a similar quagiga, Kate Kilibanje to get Nebagonyo, seat Kabota gets the invoice seat, and or it's not Nebagipchulia, not on permanent and pensionable in Quinut Neba Maguchik Alag.
When we transitioned last year, October, there were several facilities that were offering services under the National Health Insurance Funds, and they were to be moved to the other side of the Social Health Authority, so that then there will be no disruption of services. But remember, when we come up with the Social Health Authority, we also emphasized that there will be no limit where someone needs to seek services, because we used to complain that the NHF used to regulate which facility you can seek services. Now we open up so that every Kenyan can seek services whenever they want, wherever they feel that the healthcare workers have their concerns, or rather they take them seriously. Then we open up that every facility will be contracted after being empaneled, and also the professional will be empaneled for purpose of what we call pre-authorization right. Now we transition, despite the law providing for the same, they actually discriminated the clinical officers who offer more than 90% of the clinical services and over 85.7% of all specialized services. Now they have said that these officers will not be practicing freely. And that is what we are saying, that there is everything wrong currently the way it is, and that is what has occasioned, even including the RUPA, those who are owning private facilities, to go on strike. Because then, why do you have officers who cannot function in an hospital? Again, even after forcing that it's only medical officers to see this patient, they are not paying. We have seen the ministry complaining that we are not raising more funds, but we have doubled what we used to contribute.
In Kasaratan Gogi Michikibore, Goliago Tinkanda, and Gitilin, check Chip Kondo Gomanyoro, Torretit in Bagonyo, sit Agomogole, Agoten Castanagi Mochko sit, Chin Kon, and Ginetin Genitan go sit, Tigo Tinge, Agoiki by Seta, not on Gosibi, Gotomagosal Dine, Sergali, Agoyin, Ingone.
Out of the 17,000, level 2 and 3 are the majority of more than 15,000 facilities. Na hizi ndizo facilities zenye ziko vijijini na ziko kila mahali, whether private, mission or public. Now they have said that all the money we are contributing will not be used in these funds, and the estimated contribution that we are supposed to make is over 233 billion a year. So all that money has been regularized to be used in only a few facilities. As I have said, total 17,000 and 15,000 lower facility. So you can understand that less than 2,000 facilities are remaining to utilize over 233 billion. That we had, last year we had 100-day strike. We had an agreement. We signed a return to work, which was filed in court, meaning that it became a court order for implementation. It had a strict timeline in terms of promotion, provision of medical cover, and also to ensure that they can transition the UHC staff to permanent and pensionable. Unfortunately, that time elapsed, and also completion of the collective bargaining agreement. So that time elapsed, and the government is still undermanned to implement agreement that we have had, despite all that push. And that is why the agitation is here, that we must push the government to take responsibility and be accountable for everything that they are doing, so that Kenyan can benefit from public health services and also the service.